Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Today we're going to talk about neck traction. Why would somebody need traction on their neck? Typically it's because they have what's called nerve root impingement. So one of the tests we do at the office is to see if you need traction is we'll put our hands on the base of your skull and we'll lift. You can't do this yourself because you have to not have the muscles activated. But if somebody were to lift your head up, what it does, it creates a little bit more space for these nerves of your neck. If it feels good, you're somebody that needs traction. And it can be from a recent injury. That's very true. But in more cases, what I find is from an old injury, something that happened 10, 20, 30, even 40 years ago that has led to spinal degeneration. And I've got my models here to show you. And this is a normal spine. See, the vertebrae are nice boxes, and the disc spaces are nice and distinct. This is a spine that has some arthritis. And arthritis is just two things. It's the bone spurs here, which you can see a rather large bone spur there. And it is how the spaces have become narrow compared to normal. That's what arthritis of the spine is. This is actually a model of the lower back, but it illustrates the point even for the neck. So this is a story of Ruth, who is one of my patients. She's 55, 56 years old. She's got some neck complaints, pain, tingling and numbness into the arms and hands. She has a positive distraction test, and on her x-ray she's got significant arthritis in her neck. She even has a scenario where one of the vertebrae is slipped forward compared to the other, so that means that the ligaments that hold the spine in place are not doing their job. They're actually loose and lax. So I said to her, because of some other things that she has going on, I may need, if we do our 12 visits of adjustments on her spine and I'm still seeing some red flag signs, I might need to send her to a spinal orthopedist to evaluate her. And I said the first thing they're going to do looking at your films is put you in traction. So let's do that right now, but you're going to do it at home. So this is a fantastic traction unit that we sell at the office. You can actually buy these online as well. And it has these Velcro tabs here. And this is a size small, and that's the most important thing, is that you do need to get the size for you, otherwise it doesn't work right. So what you do is you put the traction unit on, and you get it fitted. It's a little bit loose, I got a little bit of wiggle here. This is a blood pressure type inflator. So I turn the knob clockwise, and then you start pumping. Now what I'm feeling for is in the back when the space of my neck, it's almost going to feel like my skin is stretching. So for me, that's 2 times 3, I can start to feel it. 4, 5 times. Now notice, it's not even contacting here or here. It's actually pulling the skin and the structure, the soft tissue structure underneath apart. And as I stand here, I can feel something into my upper back, a little bit of a pull. I don't want to go beyond there. As a matter of fact, I'm going to turn this counterclockwise and I'm going to let some of the air out because I don't want to feel that radiating discomfort or pull anywhere. I want to feel just a little bit of stretch of the skin at my neck. So if you find that you're pumping this up 25 times and you feel nothing, it's probably too big and we need to get you in a different type of traction unit, which I'm going to show you next. So to finish up with this, you're going to pump this up till you feel that little bit of stretch. You're going to leave it on for 3 minutes. That's where you start. 3 minutes and you're done for the day. You're going to do that for 4 days in a row, and then you increase a minute. So you go to 4 minutes. You do that for 3 days, and then you increase a minute. So you go to 5 minutes. You're going to do that for a few days, and then you increase to 6 minutes. And you increase every 3 to 4 days till a max of 15 minutes. Max of 15 minutes. So I feel like I've had this on for about 2 or 3 minutes now. So I'm going to turn this counterclockwise, let the air out, and then I'm going to undo the Velcro and take it off. Now I have some patients that use this twice a day and they're up to a max of 15 minutes. This will make a world of difference for your neck and your arms. So see you in a minute for the different apparatus for cervical traction.